Let's talk induction, because if you've been pregnant, you've probably had the induction talk with your care provider. And if you are pregnant now, well, you'll probably have the induction talk in your third trimester. Or maybe you're watching this video because you're pregnant and your healthcare provider has mentioned inducing you, and you're wondering how you make the decision to go ahead and do it or not. There are a lot of factors that can go into the induction decision, and I'll be covering one very important one in this video. Let's get started. Hi, I'm Ashley, and I'm a doula, a birth photographer, and a childbirth educator in the Greater Toronto area, and I'm extremely passionate about informed and empowered birth. Make sure you subscribe to my channel so you don't miss any tips, tricks, and advice to birth and parent like a boss. There are many reasons why a healthcare provider might recommend induction of labor. And if the reason is non-emergent, meaning that there's no evidence of immediate risk to the birther or the baby, you may be wondering whether induction is right for you. So some reasons why a care provider might recommend induction are being past your due date, having a suspected big baby, having ruptured membranes without the onset of labor, preeclampsia, gestational diabetes, fetal growth restriction, and even infection. As well, some care providers prefer induction because it means that they can schedule your birth, making it more convenient, or because they feel that maybe birth is inherently pathological and should be managed all the way through. If, however, you are hoping for a vaginal birth, it is important to note that there is the cascade of interventions, which refers to a higher statistical risk of cesarean delivery with every labor intervention that is introduced. What that means is that one intervention often results in another, which results in another, which increases the odds that labor will end in surgery. Induction should really only be used when the risks of continuing the pregnancy outweigh the risks associated with the delivery. And that can look different for everyone. And we also all have very different thresholds of risk that we're willing to take. So if discussing induction with your care provider, there are a couple questions that you can ask to hopefully get to a clearer picture on whether you should induce. One of those questions, and I recommend asking this for all interventions that you're unsure of, is to ask whether they are recommending induction for you specifically, or whether induction is something they offer to all pregnant people at a certain time. I'd also encourage you to ask as many questions as you need to feel comfortable making a decision. And again, this applies to any intervention that you're being offered that you might be unsure of. I know that asking as many questions as needed is often hard, with care providers sometimes rushing through appointments, but I would encourage you to push for the answers you need, even if it means that maybe you need to book another appointment to talk through your concerns and get more information. This is your birth and it's your body, and it's important that you feel informed and empowered throughout to make it the best experience possible. And it is your right to have the information required to make an informed decision. Finally, there is something called the Bishop score, which is a quick numerical score that your care provider uses to determine whether you are a good candidate for induction. The Bishop score does require a physical exam, and it looks at 5 factors. It looks at how dilated, effaced, soft, and far forward your cervix is, and it also looks at what station or position your baby is in. So for every factor, a score between 0 to 3 is given, with the highest score possible being 13. So for example, let's say your care provider checks you and determines that you are dilated to 3 centimeters, 90% effaced, your baby is at 0 station, and your cervix is soft and facing forward. They would determine that your score is 11. Scores above 8 indicate that labor may start soon on its own, and that if induction was started, it would most likely end in a successful vaginal delivery. Now, scores between 6 and 7 indicate that induction could go either way, meaning it could end in a vaginal or a surgical delivery. And 5 points or less indicates that induction started now is less likely to be successful. So while the Bishop score is not a guarantee one way or the other on how induction will go, it can give an indication and hopefully help with decision making. I also want to point out before I end that I hear a lot from pregnant people that their doctors are recommending induction at 40 weeks or sooner. And it's important to note that the average gestation is actually longer than the 40 weeks we tend to go by. So roughly half of first-time parents will give birth by 40 weeks and 5 days after their last menstrual period, with the other half giving birth after 40 weeks and 5 days, so almost a full week past the given due date. And for those who have birthed before, that median changes to 40 weeks and 3 days. So half will give birth by that time and the other half will give birth after 40 weeks and 3 days. So that's it. I'm going to be covering more on induction in upcoming videos, including what to expect from different induction methods. So make sure to subscribe so you don't miss any of that good stuff. Don't forget to grab your printable birth affirmations from the link in the description. And if you want more doula tips and tricks, make sure you subscribe and hit that like button and share with anyone in your life who is pregnant or a new parent. Thanks for watching, and I'll see you on the flip side.